Hey everyone, it's Dale here, your friendly neighborhood medical imaging recruiter. We've been doing a little bit of research on remote scanning and MRI, and I just want to provide a quick update on some of the things that we're hearing for some of the technologists that are looking and are interested in moving into a remote session. Of course, a remote environment rather. The biggest thing that we're hearing is, of course, the concerns with safety. Now, a lot of that's going to be mitigated. We know that this is not something that is just going to be randomly thrown out there without a lot of due diligence to determine if it's safe for the patients or not. But of course, that's still coming up pretty often. By far, it sounds like the majority of states or organizations are not providing that type of remote environment. There are a few out there. One that kept coming up was RadNet. I believe that they're out of California. But from what I've heard, and this is only from what I've heard, I don't know for a fact, they tend to not be a very, I don't want to say good organization because I don't know, but there's been a lot of complaints from technologists who have worked there just about the pure volume and the work environment there. So again, I don't know for sure, but that might be one organization you check out. We also had a few comments from individuals say they are doing it, but they're doing it at a remote location. So you're not going into the facility, but they still have to go into a satellite site, which I don't see how that would be too much better perhaps than going into the hospital. You're still having to leave your home and go to a remote site to scan. Some of the other factors that have come up is that the ones who are doing it, which aren't very many, as I mentioned, are also scanning multiple, or usually working on multiple scanners and scanning multiple patients at a time, usually 2 or 3 patients at a time. So I'm not sure if that's something that interests many people at all. Again, just what we're hearing out there. And then also there's something called MRI Steering. Maybe you could comment on that. I'm not exactly sure what that is, but I do know that some folks are using a medical assistant in the MRI suite, and they're doing the positioning and the questioning and all that as it relates. So maybe that's what they're talking about as MRI steering. So I'd love to hear what exactly that is for somebody who knows. And then we had another one that says they are doing remote, but it's only on the night shift for MRI. So they still have their day shift MRI patients, but instead of having a third shift, they're rolling out MRI on the third shift. So it still doesn't seem like it's catching on mainstream yet, but I'm hoping that within the next year to 2, we're going to see a lot more remote MRI jobs out there. So again, thanks again, everybody. I just wanted to follow up on that because we do try to answer those types of questions to MRI techs who contact us all the time. If any of you live in Florida, especially the Central Florida, reach out to me. We do have a hybrid position there. That seems to be more common than just 100% remote. So you are allowed to work remotely 1 day a week, and then you're at the hospital the other 2 or 3 days that you're working. It's not for everybody, but if you live in Central Florida and want to talk about that, please feel free to reach out. Thanks, guys. Have a beautiful day. We hope to hear from you soon.